fourth or fifth day, when the ventilation was through and the baby was, his lungs were doing good and we were ready to extubate him, I had contacted Dr. Vishnu Reddy and he was very enthusiastic. And we went ahead, jointly investigated. And at that time, after that, the baby came here for surgery. They did a wonderful job. And when he came back to us, he didn't really give us too much trouble. The mother needed training. It's very important that the mother is trained, because those tiny stents in the baby's even smaller nose get blocked very easily with nasal secretions. So she needs to be trained to keep those stents patent, because that is how the baby is going to breathe. Very important for every paramedical worker is that as soon as a baby is born, the orifices needed to be checked. It's a basic training that every person who is delivering a baby should check to see if the nose is patent, if the esophagus is patent, and if the rectum is patent. Because these very, very minor procedures can help save many lives. I must say that congratulate Dr. Reddy for having done a commendable job and having given the mother a live baby, because she's had a bad time. This is her first live child. And I think the credit goes a great deal to you, Dr. Reddy. For instance, in this family, the first two babies have been lost due to congenital anomalies and major congenital anomalies. This baby has excellent work done, great surgery, and the baby has recovered. But also it is due to the fact that the baby did not have any other major congenital anomaly other than a corneal atresia. Very often there are associated heart defects, and that takes the baby away. So this baby has been lucky because it had no other major congenital deformity. So, salvaging the baby was easier. Regarding your question, is it possible that the next pregnancy in this lady could be similarly affected? The risk of congenital anomalies is high, and therefore this lady during her pregnancy would need a lot of monitoring to see if she has any problems. Ultrasound lo antenatal ultrasound antnara meeru. Antenatal ultrasound, this is a very small defect and cannot be made out. But very often when there is an obstruction, sometimes there is a change in the fluid volume, amniotic fluid volume. So that is a marker which warns us that the baby could have congenital anomalies.